Hello, I'm Dr. Michael Teplitsky. I'm a medical doctor. I practice internal medicine, alternative, and holistic medicine in New York for over 30 years. And this is a continuation of the series about hormones. I did a 4-part series about low thyroid. Please check it out. Today I want to talk about hormone replacement in men and women as they get older. So this is a big topic, so I decided to break it into 3 parts. Today I'll talk about what the hormones are, what they do, why they are important. Part 2 will be about hormone replacement in women, and part 3 about hormone replacement in men. Now, replacement is probably not a good term. Really, what happens when women and men get older, their hormone levels drop, and we need to supplement. So it's not really a replacement, it's more of a supplement, but we'll talk about it later. First, I wanted to talk about what the hormones are. Hormones are chemicals that are made by special glands in your body. They are called endocrine glands. There are over 40 different hormones, and what they do is they enter the cells of the body and they make these cells do certain things. So, for instance, melatonin makes you fall asleep. Insulin regulates your blood sugar. Thyroid enters the cells and makes them burn fat and glucose in order to make energy, so it regulates your metabolism. There are many other hormones, and they all do certain important things. Now, there may happen a situation when your hormones are low, in which case we need to give you whatever is missing. So, for instance, there are people who don't have enough insulin, so we give them insulin. The same exact insulin that the body makes. But when it comes to the thyroid or estrogen or progesterone or testosterone, very often doctors prescribe chemicals that look like real hormones but are not. They look close enough, but they're not real natural hormones. So it's like, for instance, if you're thirsty and you want to drink something and you drink Coke or Pepsi, it will make you less thirsty, but it'll also give you a bunch of unnecessary chemicals that your body doesn't need. So when it comes to the treatment of men and women with low so-called sex hormones, estrogen, progesterone, testosterone, there are 2 choices. One is to give these unnatural chemicals, and another is to give what we call bioidentical hormones. Bioidentical means they are exactly the same as what your body makes. In part 2 of this series, I'll talk about how we treat women with bioidentical hormones, natural hormones. And in part 3, I'll talk about how to treat men with these natural bioidentical hormones. For right now, I just wanted to tell you that it may come as a surprise to you, but both men and women have exactly the same hormones. And so-called male and female hormones are present in both men and women. So, for instance, testosterone is supposed to be a male hormone, but women have it also. And estrogen and progesterone are supposed to be female hormones, and men have them too. Of course, women have a lot more estrogen than men, and men have a lot more testosterone than women, but all the hormones are present in both men and women. So if you're a man or a woman going through hormonal changes and you cannot get help from your doctor, that's where I come in. I've treated over the last 30 years thousands of men and women with low declining hormones, and I can help you too. Call my office 718-769-0997 to set up a phone consultation. I do consultations with people all over the country, actually all over the world. We can do blood tests for you when necessary and prescribe the right treatment. 718-769-0997. Don't forget to like this channel and to subscribe. And also, please listen to part 2 and part 3 of this series about natural hormone replacement in men and women. I'm Dr. Michael Teplitsky, wishing you the best of health.